Hello, this is Dr. Ranganadham, Senior Neurosurgeon, Ashtaprema Hospital, Amirpet, Hyderabad. Today we are going to speak on an important subject which is a point of concern to the government of Maharashtra, Municipal Corporation of Pune and Pimpri and the whole of India. Why I am saying is that there are a rare neurological problem by name Guillain-Barre Syndrome. I'll speak about the details a bit later. And there is an outbreak in Pune. Initially it started in the Pune suburbs. There's something like Sinhagad Road, Dhayari and Kirkatwadi. These are the areas. And yesterday when the news was there are 26 cases so far of Guillain-Barré syndrome. And surprisingly, today the number has gone up to 59 within the span of one day. And 12 of them are on the ventilator. Generally, anybody who is on the ventilator is considered obviously as sick. Now, why the patient is on the ventilator? The symptoms we talk about. Guillain-Barré syndrome is a syndrome wherein the peripheral nerves of the body are damaged and inflamed. As a result, the individual starts weakness of the limbs. Initially it starts in the legs, then it goes up, then to the face, and it affects both the legs symmetrically, and it starts around a half day of a sudden infection, respiratory infection like throat, running nose, cold, cough, or a gastrointestinal infection like diarrhea, abdominal pain. After that, within the 2 weeks, these problems are starting. And the symptoms, as I said, they start within the half day to 2 weeks, and they reach a plateau. They won't increase further. But within this time, the damage is occurring. And if the problem stops short with the lower limbs, lucky. If the problem keeps on ascending, that's why there is a name for ascending paralysis also. That means slowly the problem keep on increasing of the limbs. And if the respiratory muscles are affected, the patient requires ventilator support. That constitute is very sick. Causes for that, there are one cause which is now being talked about widely in the Pune outbreak is Campylobacter jejuni. It's a bacteria. And they say that it's because of the contaminated water, undercooked poultry, or stale food, uncovered food. So the authorities are giving the instruction, suggestion to the people around, as I said, Pune, Pimpri and the suburbs to take precautions, to basically take boiling water during this episode. And there are viruses also involved in this. One is called cytomegalovirus, Epstein-Barr virus, Zika virus. Vaccines are also implicated to produce Guillain-Barré syndrome. But when you weigh the advantage of betterment with vaccine is much lower of producing Guillain-Barré syndrome. Don't get scared because of the vaccine. The vaccine like tetanus vaccine, or the influenza vaccine which people take for the fever. But when you weigh the advantage of the vaccine over disadvantage, it's nothing. So vaccine does known to have a problem. And this problem during the COVID, all of you recall that the Guillain-Barré syndrome is one of the viral diseases. During the COVID, the number of patients percentage has increased. There is about 0.8% per chances of COVID vaccine also producing this type of disease. The reason why the mechanism, what is the mechanism if you'll ask, it's an immunological problem. It's something like, interestingly, this is called molecular mimicry mechanism, MMM. You can ask me what is molecular mimicry mechanism. There are cells within the body, like T cells and B cells, are overactivated by a chemical or some bacteria entering the body, like in the Pune syndrome. As I said, Campylobacter jejuni. And the cells which are supposed to protect body, they act against the body. In the bargain, They are supposed to attack the bacteria virus, but here they are so changed, they are mimicred, that they attack the nerves, which is a very sad thing. So the immune system becomes negative at the own body. This is the basic mechanism. So the seriousness we talked about, and the treatment is, of course, there are two important lines of treatment. One is IV immunoglobulin, which is a very costly affair. So I believe the Maharashtra government are considering giving in subsidized rates, because there is no definitive treatment other than this immunoglobulin. And there is another thing called plasmapheresis. I'll tell you what plasmapheresis does. Plasmapheresis is something like cleaning of the bloodstream of the antibodies which are harming the body, so that they won't create a problem to the nerves. Whereas the IVIG, they neutralize the effects of the inflammation, that is swelling which is produced in the nerves, and also the antibodies. So both ways they work. Interesting point you have to note, both of them don't need to be given at the same time. Ideally, you should start within the first 2 weeks. The effects, the results will be excellent in that time. And one of the things will be adequate, and IVIG is, that is intravenous immunoglobulin, is preferred because it can be easily given. Plasmapheresis means you require a big setup of blood bank where there is a facility to do all this facility. Only corporate hospitals are available. Now why the scare is, you can ask me. The scare is because normally in India, Guillain-Barré syndrome is not new, even in the world. To tell you honestly, in 1916, two French scientists, Guillain and Barré, have discovered this problem. And even before that, in 1859, there is a gentleman by name Landry. But somehow Landry didn't get the credit. So these two people, names, it goes as Guillain-Barré syndrome. Few old people are what you call earlier neurologists, and also they call it as Landry-Guillain-Barré syndrome. Whatever it is, the popular name is Guillain-Barré syndrome. Usually it is about 1 to 2 people per 1 lakh population. Such a rare thing. And it has been there in India once in a way. Now, within such a limited area of geographical area of the Pune, yesterday we said 26 cases. The number has gone to 59 now. 12 of them are ventilator. And not only that, in the rural area of Pune, it's about 33 cases. Pune Corporation around 11. And the Pimpri-Chinchwad Corporation, which is about 16 kilometers away from Pune, obviously the problem is spreading. And there are 11 cases. From the districts of, again, Maharashtra also, there are 3 cases. So, what thought to be localized to the rural area of Pune, now it's spreading. And why that rural area of the Pune? They have analyzed that. They have sent the samples of urine, blood, saliva, throat swabs to the ICMR, National Institute of Virology, Pune, for testing. But they thought that the first thing is that these 3 areas, what I said was Dhayari, Kirkatwadi and Khadakwasalar villages, panchayats. They are merged with the Pune Corporation recently. Now the water supply to these areas, unfortunately, is still through the old pipes. The potable water is not what you call chlorinated, it's a direct water through that. So the all the experts are thinking that's because of the contaminated water, where the Campylobacter jejuni is the harbinger that's creating the trouble. Now, if that is so, why the other areas are affected within such a short span is the point need to be analyzed. Once we get the information from the ICMR and NIV lab, probably we'll come to know it. But definitely the precautions are, it's not very dangerous problem, but definitely you need to consult a doctor at the earliest possible. An important thing is in children, this problem can be missed out because this is affecting all ages. Nobody is spared. Children, adults, old people, everybody. So children, they can be the parents and the may be thinking that it's a simple body pains. or neck pain. But now that particularly in this season, it may be important to consult a neurologist or a qualified pediatrician. And interestingly, in this problem, patient is fully conscious all through, in spite of all the sick thing, in spite of the patient is on the ventilator. And other neurological problems, the urine and the stool, sometimes they are affected, but in this disease, they are not affected. The main signs are the weakness of the limbs, and also the reflexes are not elicited when you do it. The recovery is about 85% they recover, all said and done, in spite of all this care. 15% they have some deficits, particularly when they go, unfortunately, to ventilator. And 5% they may develop complications. Suppose somebody is in ventilator, so chest infection, urine infection like this, pneumonia. And all over the world, the mortality rate, in spite of the best efforts, is about 7.5%. So, sum and substance is there is an outbreak of Guillain-Barré Syndrome, which is otherwise known as the acute inflammatory demyelinating polyneuropathy, AIDP. And the investigations are, one of course, the most important thing is CSF examination. All of you will recall CSF is putting a needle in the back and taking the fluid, cerebrospinal fluid. In that, the proteins will become high. In that, you see protein, sugar, cell count. Proteins are high, sugars remain normal. And the cell count may be normal this way, that way. But that is the otherwise known as when the cells are normal, the proteins are high. This is in the medical terminology called albuminocytological dissociation. That means there is a high of protein, but the cell counts are normal. The other investigation is nerve conduction velocities, sometimes EMG, electromyography, to see the status of the nerves, how they are reacting, because demyelination means there is a covering of the nerves which are damaged, which is a protective covering, like insulation, you can say it. And third is, so there are certain occasions we may miss out some other surgical cause. As I said earlier, there is no surgical requirement at all for Guillain-Barré syndrome if it's proved. But there are some spinal cord compression situations which may require surgical intervention, another line of treatment. There the MRI has a role. Few of the patients where this blood tests like the sodium, potassium also required, they are at low ebb in Guillain-Barré syndrome. So all in all, the treatment and all is possible in India, in every city. The government is on alert. The only thing we have to pray and hope the patients affected in Pune and the suburbs and the surrounding areas will recover faster and should not spread to the other areas. Thank you.